Here's what we know. ICU beds and the number of cases are higher but steady. One thing the governor, Dallas County Judge Clay Jenkins, and all health officials agree on: you should wear a mask anytime you leave your home. In the last 2 weeks, Dallas County has seen 200 or more COVID-19 cases daily. But last week, the county reported its fewest deaths in a single week since April 19th. As more businesses reopen, there is a difference of opinions as to how bad community spread is in the county. 14 COVID deaths were reported Tuesday, the most fatalities in one day. I spoke with Governor Greg Abbott. Do you and your team still see Dallas County and Dallas as a hot spot in Texas?
Texas, throughout this entire process, has had one of the lowest death rates in the United States. That said, we're always concerned about every single life. In Dallas in particular, even though you had these number of deaths today, you see that your hospital capacity is not compromised in any respect. There are plenty of hospital beds, plenty of ICU units, plenty of ventilators, and so Dallas retains the capability of being able to respond to the challenges posed by COVID-19.
County health leaders say the best way to track community spread is in hospitals, looking at the number of hospitalizations, ICU beds, and deaths. Right now, 65% of ICU beds are occupied in the county. Dr. Phil Wong says just because bed occupancy has been steady doesn't mean you should leave your home frequently.
The effort isn't just when we say, oh, well, we've got enough ICU beds to take care of more people, that we want to say, yeah, we can open it up and we're happy if more people get sick because we've got enough ICU beds to take care of you. That's not the goal. It's really to try to prevent death and minimize illness.
Dr. Robert Haley from UT Southwestern had a slightly different opinion, saying deaths aren't a good indicator of the COVID situation because recent deaths are from people who were sick weeks or even a month ago.
The deaths can go up or down, and it's really not an indication of what's happening, maybe even in the last few weeks. On the other hand, so that's why we're looking primarily at the number of hospital admissions and the number of ICU admissions. Those things are not determined by testing, and they're current. There are people who are just right now developing an inability to breathe.
Governor Abbott says he thinks people will be safe moving forward and continues to encourage face coverings, though they're not required. While Dallas County is trying to encourage people to stay at home with its threat level system, which only recommends what to do and what not to do. Now, today I asked Governor Abbott why he kept retailers at 25% capacity instead of increasing them to 50%. Steve, he says he got recommendations from the medical community saying that that would not be a good idea because he says, quote, it would create congregations of people in an enclosed space.
Okay, that makes sense. All right, Stephen Dial live reporting in Dallas tonight. Thank you.